An alarming report by Health and Human Services raises questions about the U.S. organ transplant system, including cases where procurement began while patients still showed signs of life. With more than 48,000 operations performed last year, some doctors are raising questions about the system and the lack of proper regulation. Joining us right now to discuss is Dr. Joseph Varon, President and Chief Medical Officer of the Independent Medical Alliance. Good morning to you, sir. Always good to see you.
Good morning. Thank you for having me.
You've warned this is turning into the commodification of human life. What do you mean by this, and how does this report support that?
Okay, so first let me start by telling you I'm a very strong supporter of ethical organ donation. When I use the phrase commodification of human life, I mean the system has allowed the value of a person, of an actual human being, to be reduced to a commercial value of a pair of organs, to say that. The new HHS report actually confirmed what many of us have been warning about. There are a bunch of cases where they start procuring organs when the patient is still alive. For example, they have spontaneous breathing, they have brainstem reflexes, or they have incomplete testing. So once you start treating a patient body as a part of an inventory more than anything else, you know, you are losing your dignity. And that's a line that the current healthcare system should never cross.
Yeah. And, you know, brain death rules vary widely across hospitals. How big of a problem is that, and what safeguards should be in place?
Well, it's extremely serious. I mean, most Americans assume that brain death is uniform, but that is not true. In the United States, brain death determination varies from hospital to hospital, from state to state, sometimes from physician to physician. Some hospitals require that you do apnea testing, other ones rely on a single exam, other ones require confirmatory tests, others don't. So there is so much inconsistency that it's very unethical in some instances to say who's really dead and who's really not. So what we need is a uniform, federally informed, evidence-based standard for what brain death is. Not, you know, actual guidelines, but mostly safeguards to protect patients.
Yeah, and donation after circulatory death is growing fast. That's when patients are on life support, often in a coma, so their prognosis is more of a judgment call, which is why it is so controversial. So what are families often told or not told before they agree to donate their loved one's organs?
I mean, when you have donation after circulatory death, I mean, that has grown very rapidly because you want to expand the donor pool. So in donation after circulatory death, when the heart stops, even if it's briefly, the procurement team comes in and starts, you know, working on getting the organs. The controversy is very simple. Is it 2 or 3 minutes of no pulse enough to declare a person permanently dead? In the US, it can be as short as 75 seconds. So I don't think that that's 100% ethical. We need to have more testing. We need to have an informed consent that is complete, because it's often incomplete because these time thresholds are so fragile from an ethical standpoint.
Yeah. So what immediate reforms do we need right now to basically restore public trust and ensure that organ donation is actually ethically transparent?
Well, I mean, there are reforms that are urgently needed. Number one, you need a true national standard for what brain death is. That's number one. Number two, you need to have transparent and honest, informed consent of the organ donation. You truly have to be 100% honest on that. You need to have an independent oversight. There needs to be an organization that truly oversees this, and not as a commerce, you know, not a business. And you need to prohibit any procurement activity before the patient meets the full legal definition of death. So no such thing as near death or likely to die. You have to verify that the patient is dead.
Yeah, and to learn more, you can visit imahealth.org. Dr. Joseph Varon, President and Chief Medical Officer of the Independent Medical Alliance. Sir, great talking to you as always. Thank you so much for joining us this morning. Happy Thanksgiving.
My pleasure. Happy Thanksgiving.